allowed to come back on commercial airlines without any problems. And those who are testing negative and are going for quarantine, they will also be allowed to come back if they test negative after the 14 days. Those who are coming from Wuhan will be brought into quarantine in South Africa. We expect that this should happen in the next few days. And the Defense Force and DIRCO are working and finalizing those arrangements, and that they'll announce to us when that's going to happen. It's got quite a lot of logistical issues of permits and ground preparations that they've got to clear. And so when they come into South Africa, they will be taken for quarantine. We've given them 21 days because the first 14 days is just to make sure that we do the observations in line with the estimated average incubation period of the virus, and then we test them, and then we use the rest of the days for final observations and integration to society. So all of these are issues that we believe it's important for us to work together. In particular, those who are coming from Wuhan, it's important to emphasize that they are not sick people. They are not actually people who have exhibited any symptoms. There will be people who we just coming to observe, and then we'll do the test. If they test positive, we'll then move them for treatment in these designated areas. We've designated 13 hospitals in the country where emergency treatment for anyone who's found to be positive would be admitted in the way that would prepare for other hemorrhagic fevers such as Ebola and others. And so that's what we will be able to do. And I think it's important for us to send a strong message that they are not people who are infected, but of course if they are infected, we'll be able to treat them. Our level of readiness is that we can treat any patient that would land in this country, and we have every province ready to treat such people. We have upped the game in the major ports with screening, with protective clothing for the staff, with disinfectants on the floors and the walls of the entry halls into the immigration and so on. We've also recommended that immigration officers must also be given masks, and they must also be given gloves and all of those issues. So we have to keep observing. But I think what we need to be alert to is that slowly this virus is settling in every country. The number is 81 today. I think in a matter of months, that number will probably touch literally every country. And so we need to now prepare for a much more longer-term issue of resilience to deal with this situation. It's a very different challenge when you deal with it at that level. At the moment, we're just focusing on emergency response, but when you're dealing with an endemic virus, you obviously need a very different kind of response and different preparations and so on. So largely, Chairperson, that's what I would like to share. If we could leave it at that, if there are any questions, we could then clarify the members. But I do want to say we welcome the debate tomorrow, and we really hope that the members will actually, in the process, add value in the debate, and we think that it's important to bring the matter to open public interest and participation because of the seriousness with which, as public representative, we must handle this matter. Thank you.
No, thank you very much for that briefing, Minister Mkhize. It has actually, as you are closing, I could just pick up that you are saying to us what it comes number one is personal hygiene. I mean, to some extent, a communicable disease will need that focus amongst all of us. We don't have it as yet, but we could have it depending on how we interact with our neighbors, with the world, and everybody else. Let's open this for comments and clarity-seeking questions from the honorable members. Starting from Governor Kwahube, followed by Hassan, Sokacha, go down to Mama Oshengwa, Honorable Van Staden, going to end with the Honorable Munyai. Okay, there's Chiro at the back. Oh, come after Munyai. Okay. Start.
Thank you, Chairperson, and thank you, Minister, for the update. First, I think it's important, excuse me, that we commend the work that has already been done by the department. The reality is that this virus has rocked some of the strongest health systems in the world. And in order for us to have any chance of beating it, we need to be able to have very solid strategies in place. So I think we've got to commend some of the strategies that have been put in place. In particular, also the work of the NICD in not just serving South Africa, but serving the continent as well. Just 3 questions on my side. I just want to find out, the minister mentioned where certain countries have decided on travel bans. Is that something that the executive is considering? If so, what would trigger something like that? Excuse me. And then the second question is, you spoke very much around there will be a need for long-term resilience strategies. And so is there any strategy from the department in particular in involving the private sector in ensuring that, we try and have partnership we needed? Because we are lucky now that we don't have any confirmed cases, but considering how quickly this could spread, can we lean on some of our private sector partners? Is that a possibility? And then if we can maybe just have a sense of how far along are the long-term resilience strategies sort of being, what's the planning sort of phase at the moment? Thank you.
Thank you, Mr. Chair. I've just got a few concerns. My first concern is that we have various videos going out as an education campaign to residents or to people from different countries. But as South Africans, if we got an education campaign in place to advise South Africans, how, what, why, and when. You spoke about the hotline, but I don't think most South Africans are really aware of the hotline. Have we got anything constructive that we're putting out there to South Africans? 2 is that we talk about personal cleanliness and so forth, which is all well and good, but I'm just concerned that some of our public health facilities don't have sufficient running water. And God forbid if anything has to break out and a patient has to go to these hospitals, how are we going to cope? And thirdly is that we know there was insufficient N59 masks, in place. How do all public facilities do now have those masks to properly protect our professional staff?
No, thanks, Chair. I think I also need to thank the Minister for the detailed report. Chair, I've got only one question. In the report, the Minister indicated clearly that South Africa doesn't have any signs of the virus. My concern and question is around stigmatization. What is there any signs of stigmatization from people that are coming from China? And if any, how is the department managing that issue of stigmatization? Thank you.
Thank you, sir, Minister and House. First of all, one will thank the Minister and the Department for the work they have done all these days, few days, while they have this pandemic of disease. Thank you, Minister. Mine is more or less same like Ishmael, because now I see this disease need the awareness to the people. Moreover, even here in the parliament, one would not know how to clean, how to escape in this disease, but we need the awareness and the emphasis of the hygiene. I thank you.
and then it would be Munai and with Shirwa after.
Thank you, Chairperson, and thanks for Minister being here this morning. I've watched all the press conferences the Minister has held so far. I think it was up to 3 since the 28th of January. And the measurements the Minister announced in the first press conference is very good measurements, which was tabled on that day. The question, however, that I have on that is, will that measurements the Minister announced be in a good managed and good administrated by the Ministry and the Department? And when, Chairperson, this virus is a very serious matter at this stage, and as the Minister has indicated this morning, more and more countries are getting tackled by this problem. So we as South Africans must not be too relaxed about this thing. There's scientists in the United States, however, who reported last month that in a year's time, more than between 40 and 70% of humanity can be infected by this virus. So this is a very serious concern and a very serious matter, and I think we must take it very seriously. However, I see that France yesterday announced that they've made a temporary ban on events with more than 5,000 people in an from spreading. Are we going to do that as well? And then the Olympic Games seems to be cancelled later this year. But that brings me to the question with international sporting events inside South Africa and outside the borders of South Africa. I think, isn't it time that we also put a temporary ban on that as well to protect our athletes from South Africa, from going there and people coming here to get the virus or to spread the virus? So that's some measurements we must look at. And then the other thing is more and more countries are in the process of closing their borders. And the Minister announced in his first press conference on 28th of January, he was talking about how weaker borders we have in South Africa. The measurements he put on the table that day for the airports and the harbour ports is very good. I must admire him for that. But I still have a big concern about our borders between our neighbouring countries. The Minister himself said that it is a we've got this weakest borders, and it's a bit of a problem. So I just want to know how far are we looking as South African government onto that matter and to handle it effectively. Then on the 13 hospitals the Minister have announced also on the first press conference, I just want to know, are these hospitals now ready? Because some staff members in that hospital say to some members of the media that they don't even know how to handle this crisis. So I just want to know if preparedness are they now done? Is the staff informed what they must do, how they must do it? And is all the quarantine areas in that hospitals in good order to go on? And then on the press conference the Minister held this past Sunday, he was talking about the quarantine areas, but I think South Africans need more information about our quarantine areas. And it's not necessary to go, we must play open cards with the public out there, because this is a very serious matter. We can't say, and with all respect, Minister, what you said on Sunday, you announced this quarantine areas, but as a matter of security, you wasn't prepared to avail any more information. But I think I'm really concerned about this thing. We must play open cards with our public out there and tell them what is going on. And yes, I think it's not for anyone to go there, but the security measurements must be very strict around these areas. But we must know where it's going to be, and South Africans must know where it's going to be and where it will be. And then the other matter I have is the fake news is going around on social media. How South African government is going to handle that matter. Because everybody is sending out recipes and do this and take this lemon and with that water and take this vaccine. But often now that's a big problem, and everybody is getting up in arms about this thing because people are scared. They don't know what to expect. And I think that from a minister and the department, we must set out, there was at the beginning clear info about how to wash your hands and cover your mouth and all that thing. But I think it must be done on a constantly basis. Actually, at this stage, I would say on a 24-hour basis. Do this, do that. And to keep the public alert onto that through the media. That must happen. I just want to check it, Chair, something, if I haven't missed something. Oh yeah, and the matter of the hotline, the Minister has announced on Sunday. You said on Sunday it's only now operating between 8 and 4. When will it be 24-hour basis constantly? Don't you think it's time to run it now, from now on, already 24-hour basis? And then all scientists around the world are busy working to get a cure for this virus, and I would like to see that this government is giving more money to our scientists here in South Africa to help to get this cure available and to get this cure so that we can start with processes in South Africa. Thank you, Chairperson.
Thank you very much, Honorable Chairperson. I think let's welcome the Minister's report, as well as the department as a whole, for proactive work they've done since the outbreak of this coronavirus. Key issues, I must say that from the standpoint of view, we have confidence into government or the state rather than the private sector. South Africa, I think yourself, Chairperson, Honorable Chairperson, you were reminding us at some point that South Africa was the first to combat Ebola outbreak here, amongst many countries in the globe. So we have confidence in South Africa's systems and capabilities, And I'm sure that's why most of the South Africa's doctors are poached to work in various countries in the world. So we have confidence in our country, in our capabilities, research development. Of course, because we're part of the continent and the globe. Again, globalization will not just move goods and services across the globe. Not only move passengers, but also move pandemic. So it should be known that if part of the global community, the spread can go on and so on. But I think we need to appreciate the fact that in China, the infection is in the decline because of the intervention and also the measures that they've taken to combat this or to reduce infections, rather. So, of course, I would say that their right to know, Honorable Chairperson, must also be linked with the right to privacy of the patient or the affected members. So the right to know should not supersede if I'm sick, if I'm infected. So therefore, I don't think it is important. It will be regarded as untransparent or not transparency if you don't disclose the area where you're going to locate those that are infected. And I'm sure that area should be regarded as national key point because the nature, the military involvement and all sectors that we've indicated should be declared that way, because otherwise you'll find the area flooded with journalists than the families or than any other people that are supposed to lend support. I think that is very much important. I'm not anti-journalism. It should not be taken that point. So I think the fake news, how do you combat fake news? Fake news also start amongst ourselves, because we're trying to politicking around the life of our people. We're trying to play politics on something very sensitive and close to the heart of South Africans, which in my view we shouldn't do. even in tomorrow's debate, I hope will uplift the life of our people and the collective combat to this pandemic with seriousness, vigor it deserves, without underplaying and propagate false news ourselves. So it's not something we should not play. Should not play games about, Honorable Chairperson. I should say, I mean, the ministry, I think, we welcome that they designated the hospitals to deal with coronavirus. I must say, the hospital of Tembisa in Gauteng, where I come from, it have running water. In fact, the hospital member was complaining about water, and me. That hospital of ours have running water in Tembisa, and it's ready. Thank you very much. And I think also, Chairperson, I'll also further propose that we consider, as the collective portfolio committee of health, do oversight trip at the OR Tambo port of entry. As the collective, it's a proposition I'm trying to put forward for consideration by the members. It is very imperative because I always believe on collectivism rather than the unilateralism. Thank you very much, Chairperson.
Honorable Chirwa, last one.
Thank you, Chairperson. Thank you, Minister, for the breakdown and the feedback on what is going on. I have a few questions here, clarity-seeking questions. The first one is, I know about the Tembisa Hospital. I want to know if there's other intervention centers that have been set aside by the department, and also the criteria of deciphering or deciding what is readiness. I'm asking this question because we already have situations or circumstances of people going to hospital, having had or having been in a car accident and leaving there with TB because of infrastructure, of overcrowding and all of those things. How will that be maintained or sustained in the case where we have to face or confront the COVID-19? And also the issue of regulating domestic transport systems, especially in poor areas like townships and rural areas, where people can't necessarily take a day off because they've got symptoms of coronavirus, and then it easily spreads in taxis and buses and trains. Has there been a strategy by the department to confront the issue from that perspective? Should that happen? Or should we still then symptom management about that, and the issue of racist stereotyping and propaganda machinery that's happening, how it will affect the people of South Africa, in the sense that there's a misconception that the coronavirus, well, it's dangerous. We can't dispute that, right? But the fatality rate is at 2% so far. In fact, the seasonal flu is worse than coronavirus because the fatality rate is at 10%, right? So now how do we manage the stigmatization and the propaganda that has been waged against us? I mean, I myself already am a victim of that. I couldn't believe it. I was working at the airport and I came across somebody of a particular race wearing a mask, and I jumped, right? And I'm a public representative. And I also saw another public representative who happens to be a minister wearing the wrong mask, tweeting about it. And I'm like, we are going to a very dangerous place if we are going at this rate. And it's going, we are putting people in panic, and we don't even have the means to manage that panic, right? So we have to draw a line between hoping for the best and preparing for the worst. For example, when I did, so coming to another question now. When I did oversight at Mamelodi Hospital, one of the healthcare workers there told me that they've dealt with Ebola cases in that hospital, right? And I'm like, how? But this has never been reported by the department. that there's been Ebola cases in Mamelodi Hospital. And I mean, I understand, because I mean, imagine the trigger it would cause to xenophobic attacks if it were to be reported in a very volatile country like South Africa that, there's Ebola in Mamelodi, right? So how do we draw the line of informing people of what is happening, and also managing triggers that our country can possibly face from different, in particular the coronavirus issue. So yeah, also about disseminating information in schools, in clinics, in parliament. How has the department managed the issue of disseminating information of how this emergency call center functions, of who can call, what the number is? Because there hasn't, I mean, we have to admit there hasn't been much done. If you don't have Twitter, you are in the darkness. And if you don't have data, you are in the darkness, even worse. You have to rely on the 30-second clip on the news every night to know what's going on around the world in regards to coronavirus. And I don't think we should be leaving it at that. What has the department done to strengthen information systems around this? And yeah. And beyond here, when I was doing this oversight, when they told me that they had Ebola cases, they told me it's because temperature is something that can be managed. Like a person can manage their own temperature, in the sense that, this is what I'm being told, I may be wrong, or the person may have unnecessarily triggered me, right? She tells me that people, when they cross the borders and they have Ebola, they take a lot of Panado to manage their temperature, so that when they pass the screening, then their temperature is already regulated. So are there any screening processes beyond temperature control at our airports? Yeah, that's all. Thank you.
Can I just ask, when was the story about Ebola?
It was early December or late November last year.
And the last request from Honorable Gela to come in.
Thank you, Chair. My apology for raising my hand very late after we have noted hands. Let me also welcome the report from the Minister. Indeed, you are doing a good job as a department. Since we heard about this virus, and you've been all around working very hard, which as a portfolio we must really appreciate, that the department is not silent regarding this virus. But also the other mechanism that we can use, members, the department have people who are working, especially we do have people who can do awareness campaign. We've got several people like environmental practitioners who always go to school and educate about hygiene and also what can be done. Already the message, Minister, is being spread across the country about this virus. And also we do have volunteers, ward-based volunteers, who always do door-to-door in every ward. They are volunteers from the Department of Health. The other issue, Minister, that I want to raise, I know prevention is better than cure, and already the department has organized. Yesterday, I saw also at the airport, when you enter, people were wearing the mask and also gloves to make sure that the department has already started to make sure that it protects our community and also the staff who are working around the airports. But also the other issue, Minister, that I want to know, maybe a clarity or a suggestion that don't we have maybe something that will help us, or maybe injection or something to prevent, I don't know, because it's a new disease that it just happened now, anything so that you can be affected, I don't know, but I know that at least the department, as we know that South Africa is the best in terms of making sure that health standards are very high to protect the community. Even during the Ebola, Minister, I know in some other years, where I come from, there was a person, a family that visited other countries and they come with Ebola. The department was very good. Even when we attend the funeral, there were measures that people must not attend, only those, and they were wearing protective clothes to make sure that those who were going to bury that family, they were not also affected by the Ebola. So I'm very confident that the health department will do all the best to make sure that our people are not dying regarding this virus. So in that case, Minister, I'm having a confidence. I will request that as members, let's work together with the department because we are also part of the department. The main fact that we are serving in the health department, let's stop being negative, but let's try also to make sure that we communicate with our people very good instead of being negative. So that will be my request because even the Bible said during the end days there will be disease that are not curable, but we need to pray to say, God have a mercy on us because we are your children. Whatever that we are doing, let's come together and make sure that we fight and we defeat this disease. Thank you.
Back to the Minister and his team.
Thank you, Chairperson, honourable members, Minister and Deputy Minister. Thank you for the questions and the interest. I think this issue is probably going to occupy us for a long time, and I think many of the issues relating to this remain unanswered from a scientific basis, and I think we'll probably find answers to some of them as we move along. On the question about the travel ban, we've looked at that. And I think that needs to be weighed up against other matters. So, for example, the US had stopped a flight